All right, well, good morning, everyone. The Long-Term Care Administrators Board meeting is convening at 9:05 a.m. on, I almost said March, on September 13th, 2024. The meeting is being held by MS Teams video conference and is being recorded. The recording will be posted to the internet for public viewing. The Health Licensing Office asks that individuals attending through MS Teams keep your phone muted and cameras off during the meeting until you are given an opportunity to comment during the public and interested parties feedback period if indicated on the agenda. Please do not use the chat feature during the meeting. I will now call roll. Carol Hankins.
Sorry. Here.
Wonderful. Samuel Weiss.
Present.
Jennifer Broadbeck. Jennifer? Yeah.
Maggie, she has resigned from the board, so you can take her off your script.
I will take her off the script.
Thank you, Maggie.
You. I'm going with my script now. So Drasti Patel.
Present.
Wonderful. Jocelyn Cook.
Present.
Emily Morgan.
Present.
Wonderful. And Corey Crimson. Another second. No. And David Lewis.
Present.
Wonderful. And Maggie Hilty, present. As members, when you wish to speak, please state your last name for the record. Members are also asked to not use the chat feature during the meeting. Public members attending in person, all you lucky individuals, wishing to speak must first sign in on the roster sheet available. For public members on MS Teams, please email Josh Page at josh.page, P-A-G-E, at oha.oregon.gov and provide your first and last name. Public and interested parties' feedback may be heard during public interested parties' feedback period if indicated on the agenda. Everyone is asked to use appropriate language, manners, protocols when conducting board business. This meeting is called to order.
All right. Can everybody hear me?
Yes.
Perfect. We were having a little sound stuff going on earlier, so glad everybody can hear me. Yeah, so we can just move right on to the first item, which is the approval of the agenda. So you guys can.
Does someone make a motion to approve the agenda?
Hankins, I so move.
Patel,
Is there a second? Wonderful. We will now vote. I'll call roll. Carol Hankins.
Affirm.
Samuel Weiss.
Affirm.
Drasti Patel.
Affirm.
Jocelyn Cook.
Affirm.
Emily Morgan.
Affirm.
Corey Crimson. Oh, not here. David Lewis.
Affirm.
And Maggie Hilty. Yay. The agenda is approved. Sorry, I'm switching between like 3 different scripts right now. I'm like, which one am I on?
So it looks like the next item on the agenda is to talk about the 2025 meeting dates. So every year, the last meeting of the year, scheduled meeting of the year, we do a couple of business things for the next year. One of them is approved meeting dates. And then after that, we're going to be talking about who's going to serve as chair and vice chair for 2025. So this is just for the meeting dates. So if you all want to discuss it, feel free to
Did
do
everyone on the board have a chance to take a look at what the proposed dates are? I don't personally have a ton of plans in September of 2025 today. So does someone want to make a But if there's no issues with the dates, does someone want to make a motion to approve the meeting dates?
Hankins, I
moved.
so approve.
And
This is Ann. Could I get a clarity on whoever moved and the second, please?
This is Weiss. I
Hankins that
move
moved.
we adopt the meeting dates.
does that work, Anne?
Yes, I need a second.
Well, this is Maggie
Yeah.
Hilty, and I'll second it.
Oh,
The
I'm
motion.
sorry, Maggie. As chair, you can't second it.
Oh,
I need somebody
okay.
else.
I'll second.
I
David
second.
Lewis.
What? Who was it? Was it Jocelyn?
Yes, that's who I heard.
Okay, thank you all
Sorry,
so much.
It's so I miss you all. I miss meeting with everyone in person. It was always so much easier. 2025. Okay. A motion has been made to approve the 2025 meeting dates. I will now call roll. Carol Hankins,
Affirm.
Samuel Weiss,
Approve.
Durasti Patel,
Yay.
Jocelyn Cook,
Yay.
Emily Morgan.
Affirm.
Wonderful. And David Lewis
Aye.
and Maggie Hilty. Yay. That is approved. The board approves the 2025 meeting times and dates of March 7th and September 12th.
So it looks like the next thing on the agenda is to select a chair and vice chair for 2025. It looks like I'm looking ahead on the materials, and it appears that everybody on the board, there's a few people that will term out their first term the next in 2025, but they would be able to reappoint. So nobody is going to be completely termed out and gone in the middle, as far as this sheet is telling me, in 2025. So everybody, I guess, is technically, except for maybe Carolyn. No, she's first term. Can't respond. Okay, sorry. Never mind.
Yeah, I think I'm the only one that can't reappoint this next time,
Yeah.
but that's not till 2026.
Right, so the board can decide to continue on with the current, they can make changes.
Well, you all know that I love to talk, so I'll talk for a sec. But I would love to remain speaking to the board. I would love to remain chair for my last little bit here as I finish out my second term on the board. And then, Vice Chair Sam, you've been a wonderful vice chair. I don't know what anyone else is interested, or please let's have some discussion. But I'd also welcome myself and others. Yes, Sam.
Weiss, I move the nomination of Maggie Hillary as chair of the board.
This is Ann. You can do them together as chair and vice chair. You could do them separately. If I'm following, you want to do them separately, Samuel?
I wasn't aware that we could do a joint, but it'd be awkward for me to jointly nominate me for vice chair.
I would be glad to nominate both Maggie and Sam for chair and vice chair for the next terms.
Patel second.
Well, thanks, guys. If there are any other interested parties or nominations, or if not, we can move forward with doing the second for that motion. Doing the second for that? Yes.
Well,
Chairperson?
yeah, we had Patel did a second.
Oh,
so
wonderful,
you can just
thank you.
do a roll call if we're okay with.
All right, we'll take roll. On the proposed chair and vice chair. Carol Hankins,
Affirm.
Samuel Weiss,
Approve A. Aye.
Drasti Patel,
Yay.
Jocelyn Cook,
Yay.
Emily Morgan,
Yay.
David Lewis,
Aye.
and Maggie Hilty. Aye. The motion passes.
Right. Moving right along. So the next thing on the agenda is the director's report. So this is a report of board members, recruitment process, the current member. We talked a little bit about this in the previous section. It looks like board should, unless, people don't reappoint or we have people that leave. Sounds like we do have somebody who has resigned from the board, so we will be getting a new member, hopefully, over the next couple of months. Not sure how long that process will take, but it will happen. So, but otherwise, the board should be stable for the next year, as we kind of talked about in the previous section. So, I don't know if anybody has anything particular to talk about. Oh, there is one little point about board member training in this section. There's some required training that all board members have to engage in, and there's also some optional training. So that's all done, I believe, through the workday process, which I think most people have had to have some experience with when they first came on, at least. So there's some ethics training and some information security training, preventing harassment, and then there's an optional training for overview of Oregon ethics law, which is always good to know what the expectation is around that. So it may be optional, but it's probably a good idea if you haven't taken it. So
It looks like there's a hand raise from Emily Morgan.
Yeah, I just wanted to request, I think I have done all the required trainings, but if I have a hard time seeing whether there are things I am missing. If you have a list of things that haven't been done, can we get sent that just so we know what we're still deficient in, if anything?
Sure, I can find out if that's possible on our end. I'm sure that there's somebody who keeps, I'm not sure if that's something that we do track on our end or if that's tracked through the governor's office. I do know that in Workday, it is a little bit of you go into the training, my training record and things like that, but it can get a little difficult to parse through sometimes. So I understand that, but we'll check into that and see if there's some kind of a list or reminder system or kind of assignment. I know that we have to, state employees, we have to take a lot of these trainings as well. And we have to take them every year, and we get the reminder sent to us via email. Remember to take your required training by the end of the year, kind of thing. So
Yeah, in medicine, we have so many. It's hard to know if I've done the OHSU related ones or the state related ones, but I appreciate that.
Was there any other questions about any of this information, and did you have anything to add that I'm not privy to, or?
Thank you. For the record, this is Ann Thompson. I'm the analyst for this board. We have had a number of staff changes. Carrie has gone on to take a promotion in another agency. And so now our board specialist is Josh Page. You will be getting emails from him. We are updating scripts. As you find, we find names here and there, and in the agendas, we have to swap all of that out. So in the meantime, if you have any questions, if you don't have Josh's email, you can contact me. And I'll take care of that for you. But other than that, I don't believe we have anything other than, we're getting ready to go into session again. I am not aware of any concepts that would affect this board, but that doesn't mean something's not going to pop up. So that's all I have for right now.
Thank you, Anne. Bringing that up. So the next item that we have is licensing and statistical reports. This is going to just be the overview of licenses issued, licenses renewed, number of licensees you have, different type of licenses that are out there, some numbers about those stats. So I think that if we starting on, if you have the materials in front of you, we start on page 15 with licenses issued, nursing home administrators. We have issued, so it's broken up into fiscal years, and then further broken down into quarters. You can see it stops at the first quarter of fiscal year 2025, which is the quarter that we are currently in. We not, well, I don't think we're quite out of it yet. It go to the 3 months after, so July, August, September. So we're still kind of just almost through the first quarter of what we would call fiscal year 2025 on this report. That's why you see the last 2, 3, and 4 blank. You probably see that as a trend through all of these slides. So I think it was worth noting. So you can see that it's a little bit, seems consistent, but we have a little bit of a bump down. I don't know that's significant, but it's just to see graphically here. And then we have residential care administrators, same information, but for that group of licensees. As you can see, the last 3 years, licensees. Current quarter being 34. The last, but we're not quite through there, so we could have a few more in the next 15 days that pop in. And then we've got license, this is renewed for nursing home administrators. This gives us an idea of kind of our distribution of how they go, but I think one of the nice pieces of information on this is letting us know how those applications are coming on paper versus online. And you can see that it's usually about, most people are going online. A few people are still sending in paper, but as we move toward and have better tools for doing that, we'll get those numbers to get even further in the blue, which is the online. Get an idea with residential care facilities for the same type of data, online versus paper, how many people. Licensed by age and gender. So this gives us an idea, it's kind of a snapshot of when this was printed, but it gives us an idea of how old people are in the profession. And you can see it's kind of, there's the big bulk seems to be between 34 and 57, it kind of tapers off from there. Looks like it's fairly even male and female. People identify as male and female. Residential care facility administrator. So this is the same data for residential care versus nursing home. And this data is a little bit different. As you can see, we have probably the same kind of group age-wise, but the people who identify as female, much prevalent in that group, in this group. And here's your nursing home administrators in training. This is this basically, again, is another kind of snapshot in time. It's an average number. at any given moment for that quarter, not at any given moment, but for that quarter. So that's why you have maybe 28.7 administrators in training. It's just because it's an average. But you get the idea. This is the people who are going to be coming into the profession. So it's important to know how many people are out there. Looks like we had a little bit of a bump 2023, but it's kind of back down to where it was at the beginning of 2022. And on to slide 22, which is nursing home administrator licensing. This is the actual number for nursing home administrator licensing. Again, it's an average of that quarter, but you get an idea of trends this way. These are active licenses. So if somebody were to go inactive or just forget to renew their license, they might drop off with this for a very short amount of time, and they may renew and come back on. But this gives us a general idea of what's going on. Now I have to it looks like it's pretty jagged, but you have to make sure that you're realizing this starts at 330 and goes up to 365. So the difference between, quarter one or quarter 3 of 2024 at 361 and the low point on this chart at, quarter 3 of 2022 is really only 20 people. So it's 20 licensees. You're really seeing that's the dynamic of this graph, kind of the scale. So if you were kind of zoom out, it looked relatively kind of flat. So a lot of change. And then residential care facility administrators. This goes down to 0. So this and when we started in 2022, of course, licensing was just getting ramped up for this group over the last several years. So I would expect to see it going up, but it went from 605 at the beginning of 2022 all the way up to 933 now currently. So it's definitely growing and going, a larger licensing base for that group. So now testing, I think that this has been an ongoing statistic on how to report these tests out. I will let you all kind of look at this chart or this graph of these statistics, and want to talk about them or have any questions, we can address those. A lot of stuff on this graph, on this chart. So I think the main thing here is that you can see the fiscal years. It's a little different orientation. You can see that 2023 totally there were 273 tests given. And 2024 there were 224, and then 2025. This is again these are different time frames a little bit than the other ones, but over the last now these are individual tests. They are not individual people. So there's a distinction between that. People could take these tests more than once on some of these. So an idea of kind of the state of testing. Does anybody have any questions or want to ponder this any longer, or get to move on? Sam.
I'm seeing that we have currently open one unlicensed nursing home administrator and no closures of that category. So why did we not get a case to look at what to do with this unlicensed administrator?
Oh, are you ahead on the regulatory report, Samuel? We can talk about that. I think we're just 2 slides away from that. So,
Okay.
Yeah.
Please note, by the way, without being able to see you, I'm not able to use your speaking by looking at you to make
okay,
it clearer than the microphone echoing from where you are sitting.
oh no, can you not see me? Okay, I'll
I
try.
can see, I can
I'll try
see
to speak.
Trampus.
Yeah,
Okay.
I can see. Sam, I wonder if you need to change the view on your camera because I can see Trampus and David. Hello, David, and a few others. But we're on page 24
Yeah,
for
I'll
the.
make sure I call. Yeah, I'll make sure I call that out and speak a little more clearly. If I'm coming over echoey or something, that can make it hard to hear. So, yeah, so we were just talking about the exams on page 24. Unless anybody has anything to talk about on that, we can click down.
I've got
Yeah,
a quick question, Trampus. Of the people taking the state, is it difficult, or do we have a number of how many of those are out-of-state people moving in, and how many are not on the state exam?
We don't have that statistic
Okay.
on this chart. I don't know if it'd be something that would be easily pulled or not. I guess we'd have to, I'd have to ask the tech gurus and the people who are, you know, entering that data if it's readily pulled, but
Well, I wouldn't want anyone to get an aneurysm to pull that. It's not,
yeah,
mission critical.
right. Just a curiosity to see what was going on. Yeah. It's hard to know what data to put on these testing ones. They can get really complicated, or they can be really too complicated, or they can be too simple. And whether or not you put something on there, and then that's always something somebody wants to know. And if you don't put it on there, you put it on there, and we're like, what's all this information? So trying to strike a good balance, but we can see if that statistic is easily available, and make a note of that.
Thank you.
All right, unless there's any questions about testing, we can talk about the fiscal. So you all are in. So fiscally, you're doing pretty well. Your expenses have been lower than the money coming in. Probably could be a lot of reasons for that. You have not had a lot of things that have been super expensive. That balance is your current balance is $938,000 with looks like kind of an average operating expense of about 130. So in that range, so you've got quite a bit of buffer. Those buffers can get eaten up fast with a very contentious regulatory case, or if the board is seeking some type of legal advice or something like that. If we have to make any major changes, so it is something that the fiscal analyst and the director does keep an eye on. So just have to see if this is if any changes need to be made. So. All right. So moving on to the regulatory report. So this is the regulatory report on page 27. So sounds like Sam had a question about one of the particular categories in here, but I'll kind of just give the brief overview. So this is the regulatory report. There are 3 bienniums still listed on this report, including the current one that we're in. So 2021, there are 4 open cases. There were 67 cases that came in that time frame. 4 are still open. Some, all, but almost all of those cases are being addressed at this meeting. So are in that time frame and being addressed at this meeting later in a executive. So the 2023 cases, that biennium, there were 71 that came in during that time frame. 44 are closed, 27 are still open. So, and then the 2025, we had 27 come in during that time frame. And 5 are closed, 22 are still open, but that would not necessarily be unusual because we're not that far. I mean, we're into the 2025 biennium, but we're not, you know, we're only partway through it. So those would be the newest cases, and we would expect to see a higher proportion of those still open. So I know we have several that we're going to be talking about later, and so some of these numbers will close. These numbers do not reflect any changes that would be made to those cases. We talk about what is open and what is closed on this report. Open is anything that has not had a final resolution, or I should not say a final resolution because that's not really accurate. I would say that it's open if it's still being investigated. It's open if it's pending my review. It's open if it's pending board review. And if board were to vote to close a case that they were reviewing, then we would put it closed. If they vote to have some kind of a disciplinary action, once that disciplinary action has been vetted and actually sent out, then we would trip that over to closed status. So that's kind of what closed and open means. So open could mean that it's going to be reviewed by the board today. It could be that it was reviewed in the past and just hasn't had a resolution. It could be that it's still being investigated. So those are the kind of the terms that we use, open and closed, and where they would be in the status. On the other side, we have complaints by type. You can see licensing concerns, services provided, and unassigned. A lot of our complaints from this board come over from not directly from clients. Some do, or not from family members or things like that. They usually come over from some other organization, like the survey crews or things like that, the survey teams and policy analysts that do the surveys, those types of things. A lot of our complaints come over from them, and they're stemmed from complaints that went through their process or surveys, things like that they're sending over for referrals. So that's a lot of our complaints come from other entities, not clients or family members of clients. So, yeah, so I think Sam pointed out, was asking questions about the unlicensed nursing home administrators, and some of those still being open. I can't talk about individual cases in the public session, just because those are confidential until they're closed. But I can just tell you that we have a dedicated investigator to this group, which is kind of unique. When we got residential care added to this group a few years ago, it was kind of mandated that, or not mandated, but we got an investigator, hired an investigator specifically for this group to deal with the larger number of cases that were going to be coming in. So, you know, she works through these cases kind of as she can, tries to prioritize them and work through them and get them to the board when necessary. So if we have something that is, you know, and also we also have to consider sometimes these cases, the unlicensed cases come in and you know, they turn out to be not unlicensed cases. There's some exemption or something like that they're allowed to work under, or it's just, you know, not true or something. So they don't turn out to be provable. So I don't know. I can't really answer specifically about any individual case, but I can answer more general questions. If you had any questions about the regulatory, Sam, I see your hand is up, so I'm happy to stop talking and let you ask a question.
Okay, this is Weiss. The question I have is, how are cases being closed without board action?
Not every board, not every case has an action on it. So many of the cases are not.
Well, we have some today where the
Yeah, that's true.
recommendation
That's
is
true.
no action, but we are still reviewing it.
Right, right. So over the years, again, we've kind of had this conversation. I'm sure how much I can really talk about. I mean, we're not talking about individual cases here, so we're talking about general policies. So over the course of the last several years, we've kind of gone through the board and got direction by the board in general over the last several years about what type of cases should be coming to the board, what kind of cases can be closed administratively on our end, and what needs to come to the board for further review before closing it. We're bringing several to this meeting because we want to, some of them, because they're issues that we want to have kind of clarified by the board in general. So we're bringing a good handful, bringing more than maybe we have in the past couple meetings, and we're going to be talking about them. But we always like to make sure that we're working with the board and making sure that the board can see what's happening with regulatory cases, and so you're able to give us guidance what it is you want to see and what it is you don't need to see. So we're always trying to strike that balance.
Then I think we need to have a conversation later, because I'm just concerned about cases coming in and being closed, but not being closed by the board. So it kind of minimizes the purpose of the board.
Well, I don't think there's any minimum. I don't know that that's, I mean, the board has a lot of, we rely on the board a lot to give us direction on what to do with these cases. Whenever in doubt, we always err on the side of leaning on the board and bring it to the board, because you all are the people that are really in this profession and really have really know what's going on out there and are able to give us the guidance we need to be able to do what we do on our end. So the board is very important in this process. So, and we want to make sure that that you all have as much say in individual cases or in general guidance that you want to have. So yeah, but we can talk about the individual cases, and then when we do talk about them, and we can get a good idea of what the board wants to see and what it doesn't need to see. Doesn't feel it needs to see everything. Okay. Does anybody have any more questions or comments about the regulatory report? No, then we are on to public interested parties feedback.
Alrighty. At this time, the Long-Term Care Administrator Board will hear public interested parties' feedback. Members of the public, this meeting is being held on MS Teams video conference and is being recorded. The recording will be posted to the internet for public viewing. Please be sure to mute your microphone and unmute only when you have been recognized. Once recognized, please state your name and affiliation to the board for the record. Is there any public interested parties feedback or anyone on the line?
Pretty public on the line, Josh?
There's a few people that I don't recognize, Thaddeus Crawford and Kelly Williams, the only two that potentially members of the public.
This is Thaddeus Crawford. I'm the healthcare navigator with Access. I have no public comment at this time.
All right. So, are we moving into, nothing else on my thing for now? Are we moving into executive session?
Yeah, that's the next thing on the agenda.
Alrighties. Switching to a different agenda thing. Okay. The long-term care, well, it says advisory board. Is that what we're called? Long-term care administrative board will now meet in executive session pursuant to ORS 192.660.2F and ORS 676595 for the purpose of considering information or records that are exempt by law from public disclosure at 9:46 a.m. on September 13th, 2024. Representatives of the news media shall be allowed to attend executive session. Audience members attending through MS Teams will now be moved into a separate breakout room, and audience members attending in person are asked to leave the room for the duration of executive session. Please continue to keep your phone muted and cameras off. Are there any representatives of the news media on MS Teams? Recognizing that there is no news media in attendance, the public will be moved into a separate breakout room for the duration of executive session. We will return to open session before taking any final action or making any decisions. It is estimated that the board will return to public session at like 11. I don't know. Is that a good guess, guys? 11? Like an hour and a half? I don't know.
I think that that's probably reasonable. I mean, it could go longer, but I don't see it going shorter.
Too much longer than that? Okay. Well, we'll estimate that, everyone. For the record, that's an estimation. Please be aware that it is possible that the board's executive session may last longer than till 11 a.m. If the public has any questions about whether the board is still in executive session, then the public can contact Josh Page at josh.page, P-A-G-E, at oha.oregon.gov. We are now in executive session.